Contact lens solutions are a major part of the success of a contact lens wearer. They can attribute to both the success and failure of a contact lens wearer. In reality, many patients have symptoms of dry eye that may be attributed to the wrong solution. And even with the improvement in solution and lenses over the years, nearly 16% of all contact lens wearers stop wearing them every year, and most of them report that the primary reason for dropping out is discomfort and dryness. For most patients, we feel that it's best for them to wear single-use lenses, which avoids both the cost, compliance issues, and complications that go along with using a solution. When a patient goes to the supermarket, they can be very confused by the variety of solutions and eye drops that they may see. Unless we educate the patient on the solution that we feel is best for them, they may report to using the solution that is the lowest cost, which in reality may be very harmful for them. In fact, as recent as 2006 and 2007, we had some major outbreaks of sight-threatening eye infections called acanthamoeba and fusarium, which were attributed to the solutions that patients were using and the improper methods that they were using to clean their lenses. In order to protect our patients from these types of issues and others, we want to improve their comfortable lens and to improve their comfortable lens wear. We want to be very specific in what solution that we recommend for our patients. Here's an example of a patient who presents to the office with no symptoms and is happy with their lenses. She says that she removes them around 7:30 at night and feels that her eyes are slightly tired, and she gets whatever solution is on sale. When we looked at her eyes, we noted something called corneal staining, which are these tiny green dots on the eye. However, she didn't really report discomfort of any significance, and at her exam, we only changed her solution and saw her back 3 weeks later. At that time, her cornea was clear, and at the next visit, she stated how surprised she was to be able to wear her lenses more comfortably, at least until 9 p.m. In addition to her improved comfort, we were also able to see that this corneal staining had been removed from the patient's eye. The literature tells us that corneal staining increases a patient's risk for infection significantly, and we feel that this corneal staining is oftentimes caused by a toxic reaction to the solution, which we'll get to in a little bit. So why do solutions matter? Solutions are important because they clean the lenses of bacteria, fungus that are in the air and that come in contact from our hands. Thus, it's important for us to clean our hands very thoroughly. The FDA has made guidelines as to what solutions must clean in order for them to be on the market. What bacteria, acanthamoeba, what fungus, they must be able to clean. So we can rest relatively sure that all the solutions out there are going to clean the lenses pretty well of these things. We're going to talk more about the two types of solutions that are on the market, a solution called multipurpose and a solution called peroxide-based solutions. All multipurpose chemical solutions have preservatives, which are really regulated by the FDA. All reusable lenses soak in the lens case overnight, and during this process, the solution is uptaken into the lens. Then when the lens is put onto the eye, the solution then leaches back out into the tears and into the cornea. If the preservative is not good for the eye, it can be toxic to the eye and then leach into the corneal tissue. And as eye care practitioners, we can observe this toxic process by using a special dye called fluorescein, which you saw before, which creates those dry toxic spots that we saw before that are called corneal staining. There's other causes of corneal staining, such as dry eye and a damage to the eye, but it has a very unique appearance when somebody is using a solution. Equally bad. If we see this process, it's really important for us to change the solution of the patient. And we've seen that most generic store brands tend to have a very old preservative that can cause patients problems like corneal staining. So we tend to be very specific on the solutions that we recommend. The major benefit of multipurpose solutions are that they're easy to use and generally require very short cleaning times. The other type of solution is based on hydrogen peroxide. This solution uses a different concentration of peroxide than the peroxide you may have in your house for cleaning skin. The patient rinses the lenses and then places the lenses into the peroxide solution and into the case. There's a special aspect of that contact lens case that neutralizes the peroxide over the course of 4 to 6 hours, and then the peroxide turns into saline water. Usually that part of the case is a platinum disc, and it's usually located at the bottom of the case. Since this portion of the case wears out over time, it's important to make sure that the patient replaces their contact lens case on a regular basis. They usually get a new case whenever they get a new bottle of solution at the store. If the solution is not neutralized all the way, when the lenses are then put onto the eye, it'll sting the patient pretty significantly. The benefits of peroxide are that they don't leach any chemical into the eye once they're neutralized. The drawback is they take at least 4 to 6 hours to fully neutralize, and if you try to put it in before that, it's going to sting. One key thing to remember that is with regards to any type of eye drop or solution is if there's a red cap, it should not go directly in the eye, or it should make you think before you put it in the eye. In the case of hydrogen peroxide solution, the red cap means do not put it into the eye. In our office, we generally recommend patients use peroxide-based solutions unless they're brand new to lens wear, and we may need to rinse, and because they're brand new to lens wear, they may need to rinse their lenses several times as they're learning to insert the lens into their eye, meaning they may drop it into the sink or drop it on the floor, and we would want them to rinse it. Thus, we would have them use a multi-purpose solution. Please discuss with the doctors and other team members in our office what our preferred solutions are in our office. They're changing all the time as new solutions are coming onto the market. Ask specifically what are the multi-purpose solutions that we use and what are the peroxide solutions that we use. Using the right solution is only half the battle to clean lenses properly. If we read the package insert for most of the solutions, it tells us that patients need to clean their lenses with a steady stream of solution for 5 seconds on each side of the lens. This means that a patient should be cleaning their lenses for 20 seconds with a steady stream of solution. This would really use a lot of solution, and it costs the patient upwards of $500 per year if they clean their lenses correctly, which we know that most of them don't. Most patients do not do this and end up saving money, but tend to not get their lenses as cleanly as they should. So we recommend patients do what the package insert says, but we also like to add a simple rub step on each side of the lens for 5 seconds. And this has been shown to significantly add to the cleanliness of the lens, just like rinsing your dishes before the dishwasher tends to clean them a little bit better. When we educate patients on their lenses, it's important to remind them of the importance of cleaning their hands. Some hand soaps have a chemical called lanolin in it that can cause contact lenses to not stay as slippery. Although this is rare, it's an important thing to mention to patients when they're being trained on how to wash their hands. Most hand washers that are out there that do it well can sing the ABCs 2 times while scrubbing their hands. Now, that would be ideal. The other thing for all contact lens wearers is to replace their cases on a regular basis. We recommend they replace their lens case at least monthly. When not replacing on a regular basis, lens cases can build up a bacteria and something that's called a biofilm, which is a goo that then protects the bacteria from the fresh solution that we put in, and that puts the patient at risk for an infection. Please feel free to ask anyone in the office any questions that you have as it relates to contact lens solution and what our preferences are.